every day and in every way. Enjoy that I find support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Diarrhea nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Diarrhea from LB Pharma. Diarrhea, love yourself.
Diarrheal diseases, particularly in children, are major global health concern, often resulting in dehydration, malnutrition, and even death. Each year, diarrhea kills approximately 444,000 children under age 5 and an additional 51,000 children ages between 5 and 9 years of age. Common causes include viral infections like rotavirus and norovirus, bacterial infections like E. coli and Salmonella, and parasitic infections. These infections can be spread through contaminated food or water and also from person-to-person contact. We will be discussing diarrhea diseases in children with our expert today on your favorite health TV talk show, The Physicians. Do stay tuned. It's another beautiful day on your favorite health TV talk show, The Physicians, where your health is our business. My name is Dr. Temitayo, and today's topic is diarrhea diseases in children. Very key, very important, and we cannot talk about a nation without having healthy children. With me in the show to discuss this very important topic is no other person than a lover of children, a mother herself, and a mother to many nations. She's no other person than Dr. Temitayo Ishola, the head of Pediatric Department, EBUTE-META General Hospital. Eko ni baje.
Oh, budget.
You're welcome, Dr. Ishola.
Thank you for
this is
having
something
me.
you're passionate about.
Yes.
You know, the last time we had this discussion, you were in green, and I said, no, I must twin with you in green. So now we equal, right?
Yes.
Yeah. Green with envy.
Okay.
Yeah. So let's talk about this important topic. I know what it is as an adult. If I have loose stool, diarrhea, it's like the world is falling apart. Let's talk about when it happens in children. So what are the common causes of diarrhea in children? What can make children to have diarrhea?
The most common cause actually is a viral infection called rotavirus.
Okay.
But other things, bacterial infection can cause it, allergies can cause it, some food intolerance can cause it, like lactose intolerance. Then sometimes it could just be due to medications.
Okay.
Reaction
like side
to
effect of some
medications in children. So those are the causes that we see commonly in children, but in majority of cases, it is viral.
It's viral.
Yes.
And it's the rotavirus.
It is rotavirus.
So what about a child that didn't take this rotavirus? Because the last time we had this discussion, you talked about different vaccination at different ages. A child that didn't take this vaccination at that age, will it be worse in this child now?
Higher risk. They have higher risk of coming down with these diarrhea diseases.
Wow.
Yes, and that is why the vaccine is very important at that age, which is usually 6 weeks, the first dose. Because from that stage, most babies are being introduced into having infant formula, and then the hygiene surrounding that process of making the food usually contaminated, and they get diarrhea diseases. But when they are well vaccinated and immunized, that incidence is reduced. And sometimes, even if it's going to happen, it will be the mild form, and the body system, because of the present antibodies and antigens that are already there, will be able to take care of that. And you see such child, even though they come down with diarrhea, it will not be with complications.
Oh.
So your child comes into the clinic and the mother says, this child vomited, had watery stool like 5 times overnight, and you look at the child, and the child is stable.
Stable. It's not looking
It's not
too
wasted.
dehydrated.
It's not dehydrated. It's not looking malnourished.
I like the fact you brought about hygiene. So let's key into this hygiene. What is the role of hygiene and sanitation in preventing diarrhea disease?
It is very important. Good personal and environmental hygiene is very important. It's key when it comes to prevention of diarrhea diseases, because most times it is through contamination of either food or water that we get these diarrhea diseases, this rotavirus, these bacterial infections. Then most times the age at which this diarrhea disease usually occur is from 6 months.
Okay.
Most times, because at that period the babies have started crawling. If the environment is not clean, they touch and they go into the mouth. They cannot control the movement to the mouth. So that is why good personal and environmental hygiene is optimal and is the best way to prevent diarrhea diseases in children.
You know, that age 6 months you just made mention of now is also the age where we advise women to start introducing supplementary.
Yes.
Can that also be another?
Yes. It is that period that we introduce supplementary feeding. Most times it is that period that children get to go to daycare centers and crèches. And so they tend to meet people, and the nannies, the people who take care of them, if they don't have good personal hygiene, a child has just used the restroom, you have cleaned up without washing hands, it's coming to prepare another child's food. So that is how this gets spreads, and the children come down with these diseases.
I remember one of the holidays we went for, we visited a family, and you know, one of the children had bugs. I'm like, we had 2 babies that were, you know, 5, just above 5 and less than 5. And I just told my husband, we don't know. If whatever we have a day and next day, possibly we may not go. And exactly what happened. We got back to our own residence, and one of our kids just went down. All the activities we planned, all the tourists, you know, whatever we could do, because we now had to quickly go into, we don't want to come all the way, how many hours, you know, across another continent and lose the child. And that takes me to the next question. How effective is oral rehydration therapy in treating diarrhea?
Very, very, very effective. When I have opportunity of talking to our mothers, I tell them there are 2 things that you're expected to have in your house as a mother.
Okay.
Analgesic, the basic, which is paracetamol, and ORS. Anywhere you're going as a mother with children, whether babies, whether toddlers, you must have those 2. Because diarrhea can start at any time. And ORS is the best thing that you can give to any child who is having diarrhea. It does not only replace the fluid, it gives back the electrolytes which are lost in the kidneys. And if those things are not replaced, it can cause severe capillary shutdown, it can cause renal shutdown, and if care is not taken and is not treated on time, it can lead to irreversible shock. And that will be the end. So,
I don't have ORS, and I got to another home whereby this child is having diarrhea, which I didn't anticipate. What can I use immediately to substitute this ORS?
Before the advent of the ORS sachet that we all know, we do saltwater solution.
So please let us teach our family, because this is a family show.
Yes, we would like to teach them, but I wouldn't want us to dwell on that.
Okay, yeah.
Because of
that's true.
The personal hygiene that we talk about.
Because
we need safe water, we need sugar, we need salt at an appropriate quantity. But the ORS is readily available everywhere. That you can easily get. And it's cheap
and it's affordable.
So my advice is, please ensure you have ORS sachet, even if it's just one.
And
at
start
home.
with something.
And at least you will have water that you can use to mix it.
So this is why water is life, you say.
Yes.
Because if you don't have ORS immediately, at least clean water before you get ORS. And if you have to make, you still also need
a
clean water to make that ORS.
Yes.
Every day and in every way, enjoy that I find support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Diarrhea nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Diarrhea from LB Pharma. Diarrhea, love yourself.
Welcome back. If you are just joining us, this is your favorite health TV talk show, The Physicians, where your health is our business. Before we went on break, we were discussing about diarrhea diseases in children and how important it is for us to have a clean environment, practice personal and, of course, environmental hygiene. And if there's anything that a mother that has children must have in her home, I need to reiterate this. If there's anything for you as a mother, as a parent, must have in your home, it's paracetamol of any brand, because there are different types, right? And on the other side, ORS. That's sachet. That's, once it may be your child that has diarrhea, it may be somebody that brought a child to your house as a visitor, and that may just be the game changer and the lifesaver. And if you're even going out, you see that your big bag. A lot of times people laugh at us that women are always carrying big bags. In fact, you can bring somebody out of that bag. Ensure you also put paracetamol and ORS there, because children can easily have diarrhea from touching things, from putting things in their mouth. For those that have toddlers or those that just have babies that are crawling, the crawling phase, these are some of the things that can happen. So if you are not taking anything away from this program today, have your paracetamol and your ORS in your bag wherever you are, at home and when you are going out. Dr. Ishola, this topic has been mind-blowing and eye-opener, and why it is very important for us to have those hygienic practices within our home. Now, my next question is that, what are the most effective ways to prevent dehydration in children with diarrhea? Because that is the commonest thing that happens.
The most complication that we have is dehydration. And how to prevent the diarrhea from occurring in the first place. Prevent diarrhea from occurring, and that starts from our immunization.
Yes, that's true.
Then our environment, keeping it safe for our children, our nutrition, making sure that whatever they put in their mouth is clean and safe. So when diarrhea now occurs, taking the necessary step at the right time. The ORS, as we said, is very important. If a child has, for us to say that if the child has diarrhea, we have noticed that, my child poos only once in a day. Okay. Or my child poos morning and night. So by the time the child is having 4 or 5 episodes of stooling, you don't wait until the child starts feeling weak. You don't wait until the stooling now becomes so watery and is only water. Once you notice the frequency and the consistency of the normal stool your child usually passes is changing, you can start to work.
So it's not a one-size-fits-all.
It is not. So once you are able to start the ORS on time and you are replacing the fluid that is lost from the diarrhea, then you are able to prevent dehydration. So we can have diarrhea diseases that will not lead to dehydration. Or if there's going to be dehydration, it will be the bowel flow that can be taken care of by the ORS.
For the benefit of our viewers, because this is a family show, how often, so if your child has diarrhea, how immediate do you start ORS and how often do you give the ORS to that child?
We advise that ORS should be given after every loose stool.
Okay.
After every loose stool. My child poos and is not watering. Is not usually watering. So by the time I have a child who poos 2-3 times in a day and is watery, is coming out of the diaper, then I know that there's something wrong. Please start your ORS immediately. And after every poo, give ORS. And you don't just give ORS and stay at home.
Okay.
Please seek medical advice.
While you are giving ORS, you are going
to the hospital. You are going to the next health facility to seek help. Because sometimes it will start small. And if nothing is done, it becomes big and complications set in.
Please help us bust this myth about diarrhea and flagyl. Because it's a big problem.
It is. Most times as they are coming to the hospital, especially in the area where I practice, you see them come with bags of drugs.
Can you imagine?
Not just flagyl. They come in with bags, a bag full of drugs. They are bringing this one, they are bringing that one, they're showing you this is what I've used. They've gone to chemist or pharmacy and they have up to 6 to 8 drugs that they give it to the children or to the child.
For diarrhea.
For diarrhea. At the end of the day, the basic one, the most important one, which is ORS, will be missing.
Is it that they don't believe in ORS or they think it doesn't
Some of them
work fast?
don't know. Some are ignorant. Some, they think, oh, because there's only diarrhea and there's no vomiting.
Oh.
That there's that belief and that means that ORS is only for gastroenteritis. That is when there's vomiting and with diarrhea. That is the only time you use ORS, which is not. There can be diarrhea alone, there can be diarrhea with vomiting. ORS plays key role in both. And another myth I would like to talk about is diarrhea and teething.
Yes, please speak more of that. There's no relationship.
It does not have any relationship. It does not have anything to do with each other. I keep telling my mothers, when do we do anything extra for the nails and the egg that grows in our children? No. It's the same thing with teeth. The teeth are already there from in utero while the baby is in your womb. They grow as they grow old, as they age,
they start coming out gradually.
They regresses and you see the white thing coming out. But because of the personal and environmental hygiene that we talked about, it is usually when the children are crawling, when they stand, when they touch things, that is when diarrhea is common. And so at that time, from 6 months is when you see teeth coming out. And so they believe that a child who must bring out teeth must have diarrhea, must vomit, must have cough.
So we will start treating before the diarrhea?
Yes, there are a lot of drugs for that. You have this one, that one, that is mainly for teething. With teething powder, with oral syrup for teething. And I keep telling them, please, it is not true. My mothers, it is not true. Diarrhea or any teething has nothing to do with any symptom at all. If your child has anything, please seek medical advice. And there's another myth. Diarrhea with teething must not be stopped.
Oh wow.
Once you stop the diarrhea, the teething will stop. The teeth will not come out. So because of that, the children are having diarrhea and they will not seek medical help.
And that child can just die?
The child will come to the hospital very bad with severe dehydration, with sometimes renal shutdown, sometimes in shock, with underlying malnutrition, and it is usually a tough one for medical professionals to be able to save such lives. Diarrhea has nothing to do with teething. Please and please, whenever a child has any symptom at all, seek medical help.
Diarrhea that is mucoid and bloody, what does that entail?
That signifies that there is bacterial infection.
Okay.
And in such cases, that's why you have to investigate. A stool MCS would be able to know which organism is there and the ideal drug to be used. So when we are asking for, when you are taking history, that's what we ask. Is there blood? Is there stool? Is there mucus? Is it watery? Is it loose? Is it like rice water? Does it smell? How often? Was it after the child has eaten something? Or did you notice that it was due to after you've given a particular food? You know, such interaction, taking history is going to help to know what is needed to be able to treat such child.
Time is never our friend, but thank you so much, Dr. Ishola, for this amazing, eye-opening discussion when it comes to diarrhea in children, especially those nuggets of there is no correlation between diarrhea and teething. And please, if your child is teething and has diarrhea, treat. Don't let the child get dehydrated. Don't let the child get malnourished. Don't bring the child to the hospital when it's just, just a thin line between life and death. Once again, thank you so much. To all our viewers out there, you've heard it from the expert. She's not only just a physician, but she's a model, and she has schooled us. For me as a physician, I've also learned quite a number of things that I'm taking away from here today and re-emphasizing. I don't have babies in my house, so I've never really had much reason to keep ORS a lot of time because I looked at the expiring date. But as it is now, I'm going to look for and buy and look for the one that will expire in 2 years' time. Because you may just be coming to my house and then the child has, diarrhea. What do I do? Emergency first aid, and I'll quickly do what I need to do. Please pay attention to your personal and environmental hygiene. Those are the prevention. But the very first prevention which we talked about here on this show is the routine immunization. Give your child immunization. It will help to reduce the risk of diarrhea. And even if the child eventually has diarrhea, it will reduce the impact and of course the complications that come with it. My name is Dr. Temitayo, and please be kind to follow us on all our various social media platforms. If you want to be part of the show, go to our website, thephysiciansng.com, fill the form, and we'll be right here, so speaking to our viewers. Until next time, remain blessed.
Every day and in every way, enjoy that I fight support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Diarrhea nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Diarrhea from LB Pharma. Diarrhea, love yourself.